quality, I think it means different things to different people, right? So for large organizations, sometimes it's their contracts that are based on these quality measures. So for them, it's sort of a financial impact of that. For clinicians, it may mean a different thing, trying to sort of say, are they taking good care of their patients? Some of those are meaningful measures, others are not. For a lot of people, I think if you truly ask them, is a burden, right? The way the measures that are being reported on, the data they have to provide, they feel that's really burdensome and not really improving the true measure of quality. We just recently wrote a piece on something we call measurement with a wink, is that we have a lot of measures that really are checkbox measures, but really don't fundamentally improve the care delivery for patients. And that's where we want to get to, is sort of, do we need to think fundamentally different ways? Because historically, quality measurement has been based a lot on data that are available. Not really what should be measured, but what can be measured. And oftentimes that's not the right approach from quality measurement perspective. And so that's why I think there's lots of opportunity. There was last year a study that was published about billions and billions of dollars that are spent on just measuring quality that could be used to actually delivering care. So lots of different opportunities in that space. We've made, I think, in the last 10 years, huge progress in terms of how we measure it. But I think there's opportunities to sort of take it a little bit further and make it much more meaningful, both for patients and clinicians, rather than just having it truly driven by payments. In terms of owning it, I think there needs to be a central enterprise that does it meaningfully. National Quality Forum, NQF, has been sort of the steward of that for years, but they basically are quality measure approvers. How you should then implement has not been studied very well. And so there, I think there's opportunities for payers, patients, clinicians, and providers broadly, institutions, to collaborate, sort of say, how can we do this meaningfully? And so there's going to be differences in how people view it. So it's, how do we make these marginal improvements? So for example, we are working, one of my colleagues is leading a project right now that's not just saying, is your diabetes under control? But we've recently shown that diabetes, to get it under control, you can overtreat and cause harm to patients, or you can undertreat and cause harm to patients. So she is creating a measure that actually looks at, are you appropriately treating, are you overtreating or undertreating a patient, that leverages both EMR data and claims data. So it's sort of a novel way to sort of just make an incremental improvement. It's not something drastic, but it's sort of a balanced measure that may actually have impact on patients as well as providers. So that's an example of sort of incremental improvement. Now, there may be some approaches to sort of say, are there really ways to sort of put the whole thing, on top of its head, to sort of actually go and observe how care is delivered? Are there qualitative approaches to identifying these measurement approaches? And so this will be sort of an approach that will require a lot more research and development, but I think will give us maybe much more meaningful changes in quality measurement enterprise going forward.